Mental Health First Aid. My name is Denise Ellsbury, and this month we're joined by Kristin Hartsaw. And Kristin works for the DuPage Federation on Human Services Reform. I had to practice that one, but I got it right. And she's the program director for training and technical assistance. So welcome, Kristin. Thank you for being here.
Thank you for having me, Denise.
So we do want to talk about healthcare insurance in a little bit, but why don't we start out by talking about what is the DuPage Federation on Human Services Reform?
Sure.
And what do you do?
Sure. So the Federation, as we like to shorten it, the Federation is a nonprofit organization. We are a planning and change management organization, and what our mission is to improve the lives of vulnerable populations. Okay. We do that by looking at systems issues and really focusing on the health and human services safety net.
Okay. So when we think about vulnerable populations, what does that encompass?
It can include many different populations. Most often you might think of people living in poverty or the working poor. It could be immigrants, refugees, it could be persons who are homeless, many vulnerable populations, children and elderly as well.
Okay. And so you said you focus on human services, and healthcare. So, like, what kinds of activities do you guys do?
Sure. So we are involved in a lot of different things, and maybe it would help to talk about a little bit of the history of the Federation. So
sure.
The Federation has been around since about 1995, okay. And it was the result of a governor's initiative. And at that time, there was legislation moving through Congress and passed in '96, commonly known as welfare reform. And it changed the rules about welfare reform. And so we were one of several federations throughout the state. I believe the DuPage Federation, and there might be one still in the Springfield area, is all that's left from that original initiative. But our scope of work has changed. And so one of the projects that the Federation historically has been involved with was the development of the Access DuPage program. And that is a charity care program for uninsured individuals. Okay. It places them with a medical home. So our director was involved in kind of the research and development along with other coalition members. Some of the other things more recently that we have been involved with, my colleague Catherine Nelson and I were part of the state of Illinois' training team for the assister workforce. And what is assister, right? But they go by many different titles. They could be navigators, they could be certified application counselors. This was the workforce that was trained to enroll persons in ACA marketplace insurance or Medicaid. So we were part of that training team. But we do a lot of different things, and we have a couple of programs that provide some limited direct service. For example, our Open Door program is kind of a short-term case management program for persons facing a crisis. And what they can help with are a variety of issues. Persons who have an eviction notice, persons who are homeless, maybe persons whose medical coverage has been interrupted for some reason, and they have medical needs or they need prescription assistance. But a number of different short-term issues that they can help link and refer those persons to so they can access services and hopefully stabilize the situation. Okay. We recently received a state grant for a welcoming center, and this welcoming center really is for any immigrant or refugee in the DuPage County region. There are a number of welcoming centers throughout the state, but it is a free service, and again, it's all about linkage and referrals and connecting those new immigrants and those refugees to services that they qualify for.
So would those refugees or immigrants, they could be people that came here on their own or through another organization?
Absolutely, yes. They could have been, as a refugee, they could have been resettled. In our region, in DuPage and Aurora, we have the World Relief Organization that resettles refugees specifically, but immigrants can enter the country under many different types of visas or many different entry statuses. So the Welcoming Center is available to any, regardless of entry status.
Okay.
We also, I should mention, we have a Language Access Resource Center. We call it LARC for short. But this program, we train bilingual individuals to become interpreters. And then we have contracts with a number of different healthcare organizations, schools, even the court systems, to then provide interpreters to individuals who have limited English proficiency.
And is that in several different languages?
It is. Please don't ask me to quote all the number of different languages, but many of the top languages, Spanish, Polish, Urdu, Gujarati, but many, many more. So if people are interested, they can visit our website to learn about some of these services.
Okay.
Now my role is as the Director of Training and Technical Assistance. My primary role is to conduct public benefits training. And when you think public benefits, think of programs such as Medicaid or SNAP, the food stamp program, or now ACA, Marketplace Insurance, as well as some of the cash benefit programs through even the Social Security program.
Okay.
Things that people earn, like Social Security insurance or Medicare. And so we train providers, whether that's social service or medical and healthcare providers, on the different eligibility rules, because the public benefits programs, they are complex.
Yes.
They have different eligibility rules relating to citizenship status, income, relationship to the persons in the household, many different rules. And so we train them how to navigate these systems and refer clients, and really when to troubleshoot, maybe when a decision is made that doesn't make sense or has impacted the family. On top of that, I also get to train mental health first aid, which has become a passion for me. I love that program. But I also facilitate cultural competency trainings as well. So we keep busy.
So you have to kind of have a fair amount of expertise in a number of different areas then in terms of those trainings.
Indeed. And what I would say about public benefits is that we are constantly learning. Rules change along the way. Sometimes there's very specific or obscure rules that impact very limited populations. And so if we don't know it off the top of our heads, we will definitely look it up.
So you know how to find the information, which is
and sometimes that's
a key piece.
Exactly.
Right. And so I know in the title of your organization it's DuPage, and so that is pretty much the boundaries of where you provide service, or do you go beyond the DuPage County borders?
We certainly find ourselves going beyond the DuPage County borders. Historically, that is our home base. Our board members currently are comprised of DuPage serving organizations, but we have been doing training statewide for several years at this point. And we also, with our LARC program, have been working to expand into other collar counties like Lake County. So really wherever persons have an interest in, or providers have an interest in our training programs, we will go to them. Some of our other services, however, like the Welcoming Center, our Open Door program, currently are restricted to DuPage County. So it just depends on the interest and the need. Okay.
So for some of those public benefit trainings, there's a cost for that?
Yes, depending. Okay. Yes, there is. Currently, we were awarded a training grant from the Department of Human Services to conduct some training related to the Immigrant Integration Program through the Department of Human Services. So when we have a grant to subsidize the programs, the training programs, we do not charge, but typically there is a fee to attend our other public benefit trainings.
Great. So when we come back, we're going to take a break. I want to talk a little bit more about healthcare specifically. So join us when we come back from the break to really dig into healthcare and health insurance. Welcome back to Mental Health First Aid. We've been talking with Kristin Hartsaw from the DuPage Federation on Human Services Reform. She was telling us about what her organization does, but now we want to really kind of get into that piece about talking about healthcare and health insurance, which of course has been so much in the news.
It is a hot topic.
It is indeed. So let's just start at the basics of, how do people get their health insurance?
That's a great question, yeah, and I think it's a very timely question because with the Affordable Care Act, everyone in the United States, if you are a citizen or lawfully present immigrant, you are required now to have health insurance. That's one thing that the law did. So what are people's options for coverage? Well, if you work in a job that offers health coverage, health insurance, that is one avenue in which people can get their care. Also, there are government programs, so Medicaid and Medicare, and I will say people often confuse the two.
I'm notorious for mixing them up.
So the way I keep it straight is Medicaid, think of you are aiding the poor, you are aiding low income. That is the government health insurance for low income persons and families. Medicare, you are caring for the elderly or the disabled, and so Medicare is the health insurance program for persons who are age 65 and older or who have been disabled. And you pay into the Medicare system through your FICA taxes, so it's not an entitlement program. It is indeed something we pay into the system for.
So you used the term earlier, it's something that you've earned because you've paid into it.
Exactly. If you are a student, a college student, perhaps your university offers health coverage as part of the fee schedule with the university, or you are purchasing insurance on the individual market. And historically, the market between employer coverage or group coverage, as it's sometimes referred to, and the individual market, there was a disparity, and employers were offered a lot of tax credits to offer health insurance to their employees, and it was a good incentive to do so, to even hire the best people, right? But the individual purchasers, we didn't have a lot of negotiating power, and so you saw many people go uninsured because they could not afford those individual plans. The ACA has worked to address that affordability issue in a couple of different ways, and I'd be happy to talk about that.
Please.
Okay. So there were two main ways that it worked to increase affordability. Part one is to create this new way to shop for health insurance, a new individual market. It's called the marketplace. You will often hear it referred to as exchange or state-based exchanges in the media because that's where the original legislation, that's the wording that was used. And really, it is a new way to shop for health insurance. So many people that I worked with, especially in year one of this marketplace rolling out, thought they just had to sign up for one plan. But no, what it is that you are applying for financial help if your income falls within a certain range. And you're applying for financial help to get a discount, and then you go and shop and buy a private health insurance plan offered by a private insurance company, and there were many different companies offering plans on these marketplaces.
So there was a mandate that you had that everybody had to have insurance, but it wasn't saying here's the insurance you have to have. It was saying, and here's this new place that you're going to go make decisions about what kind of health insurance you want.
Yes.
Okay.
Yes. And the way the financial help works with the marketplace, it's in the form of a tax credit. It's called an advanced premium tax credit. So you fill out an application. It's based currently on your income and your household size. And there's some other pricing issues as well in terms of age and where you live. But the main criteria for the tax credits are your income and household size. And so then based on that tax credit, you then apply it to the plans you're looking at, and it discounts the monthly premium. Now this premium tax credit is available to persons who earn 100 to 400% of the federal poverty level. To give you an idea, for a single person, that's upwards of just over $47,000 a year. For a family of four, it's upwards of $97,000 a year, just a little over that.
So if you earned that or less than that, then
you might get a discount on that.
But the discount could vary.
It varies, and
according to those factors.
That's right. And I will say, the closer you are to the income limit, the less of a discount it is. But for others, I have seen significant cost savings on those plans. They also built in some other things for persons who earn on the lower income spectrum, and things called cost sharing reductions, and this reduces things like the deductible, which is the amount of money a person has to pay before their health insurance starts covering, or some other co-insurance cost sharing requirements. But that's available for persons who earn less income than the 400% FPL.
Gotcha.
The other way the ACA made health insurance more affordable was by expanding who could get Medicaid. And this is an interesting issue in terms of policy. So before the ACA, you could only get Medicaid if you were low income and fit into a particular category. You were either a child, or you were a family caretaker, relative of a child in the home, or you were a senior or person who was disabled.
Okay.
Or you were a pregnant woman.
Okay.
So, which sounds like a lot, but essentially it left out low-income adults without dependent children. And so you had many, many persons who didn't have a path to health coverage because they didn't fit into that category, even if they were low income. The ACA expanded coverage to all low-income adults as well. And you may have heard that the ACA had been challenged constitutionally, and the Supreme Court ruled on the Medicaid expansion piece in one of its early rulings and did make that provision optional for states. The takeaway is Illinois did expand Medicaid, so we are covering that population.
Okay. Now, some of the other things I know that they talk about in terms of the ACA are expanding coverage for young adults. They can stay on their parents' insurance. So it made a couple of those other kind of tweaks on things too, and mandated certain things had to be provided in health insurance.
Yes, we call that the consumer protections. So a lot of discussion around the ACA I know does focus on insurance coverage, but we need to also acknowledge the significant consumer protections that came from the ACA. So as you mentioned, young adults can stay on their parents' insurance until age 26 or age 30 if they are a veteran.
Oh, okay.
It also prevented insurance companies from denying coverage or charging more for coverage for persons who had a pre-existing condition. So a chronic condition, even something like diabetes or cancer or something else, a pre-existing condition. In the past, before ACA, insurance companies could charge more or even deny coverage. So we heard a lot about that recently, that people like that part of the ACA. Some other consumer protections are the essential health benefits. And so the ACA mandates that insurance plans now offer coverage in 10 categories of care. And that's everything from your doctor's visits or your hospital stays, but also maternity newborn care, laboratory services, ambulance services, prescriptions. So 10 categories of care. And my favorite,
mental health, right?
And mental health, and that's my favorite addition. So now that it's expanded behavioral health services due to the ACA.
Yes. So we need to take another break, but when we come back, let's talk a little bit more about how people can be good consumers of their insurance.
Great.
Okay, awesome. So join us when we get back to focus on that aspect of healthcare.
Their support changed my life. Their support changed my life.
They were like family. They were like family.
My voice is now heard. My voice is now heard.
A home for every animal. A home for every animal.
My future is bright because they care. My future is bright because they care.
This is our home now. This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day. That serve Cass and Clay counties every day.
Welcome back. We've been talking with Kristin Hartsaw about the Affordable Care Act, and particularly just trying to understand health insurance in general, the way that people get coverage. But But I've just been thinking a lot with it being in the news is, how can people be good consumers? What does somebody need to know about their own insurance? What questions should they be asking? And we were just touching on those essential benefits, which I don't think people always understand that's something that maybe insurance didn't offer before, but does now, and that you and I love. The piece that is now required is mental health coverage.
That's
so
right.
Talk about the significance of that.
Sure. So prior to the ACA, plans could offer any kind of package, and some offered very comprehensive packages because that's how they attracted consumers to purchase the plans. But they could exclude certain things like mental health or substance use disorder treatment, or they could exclude maternity care as well. And so what the ACA did was mandate that qualified health plans, large employer plans, going forward now, having to mandate these 10 categories of coverage. So it's greatly expanded access, and I'm thrilled about the access for mental health and substance use disorder treatment.
Absolutely.
It's not to say that that's still not without challenges and access issues. You may have waiting lists depending. And what people really need to understand is your payer, your insurer, really does drive where you can go to receive care.
Yes.
And so those are some things in order to be a good consumer, even when selecting a plan, to think about, okay, is my doctor that I go to now in that plan's network? If I needed a planned surgery, what hospitals are in that network? Is there one that I prefer or over another? So things like that. What are the prescription formularies? Each health insurance company, and even within products within the insurance companies' offerings, can vary in terms of scope of coverage, and prescription formularies is another thing people should consider. That's where the pricing of your medicine comes into play, and there are different tiers based on if it's a generic prescription versus a brand name, and they often have preferred versus non-preferred brand name, and now even a tier 4 for specialty drugs. And the higher the tier level, the more money a person will pay for their prescriptions.
Okay. Just thinking about that piece of like where you can go, is my doctor and take this insurance kind of thing. I know, again, working from the hospital standpoint is, when people are trying to access maybe those more outpatient services for, in talking about mental health, a clinician, a counselor to go meet with, that counselor may or may not accept your insurance and receive payment from your insurance. And even within an insurance company, there are different levels of care, right? And so being able to ask those questions as well.
Yes, it depends on a number of factors, how the plan is structured, what the cost sharing requirements are for consumers. And in some cases, something as simple as the difference between an HMO and a PPO. And HMOs, typically you cannot receive care out of network. And then with PPOs you can, but you'll have higher cost sharing out of network. And I see that, I did an exploration of just some of the marketplace plans that were offered in the DuPage area for this current year, and was looking specifically at those mental health and substance use disorder services. And I saw a range. Saw a range from very affordable copays, for visits, to very expensive copays, especially for inpatient hospitalization.
Yes.
And my concern is that, if someone has a $750 a day copay for inpatient hospitalization, will that prevent them from seeking the behavioral health care that they need? But again, it depends on the plan, and I really hope that people will work with their providers, because even if you do have those cost sharing, many providers will have financial assistance programs as well. So we want to focus on keeping people well and accessing care when they need it.
Right. So just looking at that piece about, we know that if people can access those wellness visits or the prevention kinds of things at something that's not going to be too expensive for them, they're more likely to use those, which we would hope would keep people healthier.
Yes, and I'm so glad you brought up preventive services, because that was another consumer protection really under the Affordable Care Act, is that as long as you're using your plan's network of providers and going within those guidelines, There are a number of preventive services that are at no cost to the patient. So they could get their depression screening, or if their child needs a behavioral health assessment, even things like vaccines, immunizations, or mammograms, things like that. They're considered a preventive service, and so there is no copay, there is no co-insurance split for the consumer.
Nice. So from a consumer standpoint, when you're teaching people, what are the questions that they should be asking, or what are the things that they should be looking at in terms of making a selection about insurance? Because even at the hospital, I know every year I get an option of what level of, what kind of coverage do I want? So what questions should people ask?
That's another great point. So it kind of comes down to cost for many families, right? So many times I heard from people that they were really concerned about that monthly premium. But I also encourage people really explore those other cost sharing requirements. What is the deductible for the family or for the individual? Because you may have a low monthly premium, but then when you go to use the care, if you do have a high deductible plan, you'll be paying full cost for your health care until you meet that deductible. So those are some things to consider. Again, what are some of the other incentives? Some plans, even Medicaid managed care plans now, offer incentives like gym memberships or additional services that maybe haven't historically been offered before. So explore the entire package. Every insurance company must offer a summary of benefits coverage, and this is a document. It's the same template regardless of which insurance company you use, but it spells out those costs, things like copays for an emergency room visit, or what is your specialist visit copay, what are the prescriptions. And what you also want to do is, even if the insurance company or with Medicaid managed care now, even if their provider directories are showing that your provider is in their network, always call your provider to make sure. Also call a provider to make sure that they are still taking new patients with this plan, because providers can limit the number of patients from all of the different plans that are out there. And so that's something to just make sure that they can access care when they need it.
So thinking about if this has been my doctor and I want to keep my doctor, but I'm making a switch on insurance, just call the doctor's office and say, hey, is this going to be a plan that you're going to accept?
Yes.
Okay.
That is a very good consumer strategy.
And then people also looking at so aside from this is what it's going to cost me every month, is also looking at what are the specific healthcare needs of my family.
Yes.
Because that could really make a difference in what kind of insurance you might need.
It could. And you just want to assure that the plan is covering what you need.
Okay. All right. Where can people go to get good information about health care?
There are so many resources available. So I will say the healthcare.gov website, which is the new marketplace insurance.
Healthcare.gov.
Healthcare.gov does have a lot of information, but in terms of other consumer resources, there is Enroll America, Families USA. In terms of how to use health coverage, another good website is Raising Women's Voices, and even though it is geared towards women's health care, the health insurance concepts translate to any population.
Awesome. Well, Kristin, thank you so much for being here. You've given us a lot of great information about a topic that people I know feel so confused about. So I really appreciate you taking the time to be with us.
Thank you for having me.
All right. So thank you for joining us on Mental Health First Aid, and until next time, be well.